Hey everyone, thanks for tuning in. Steven here with Team Euphoric, and this is day 7 of the 80 Days to Your Dream Body course. Today's protein source is going to be mackerel, and today is going to be a chest training day. And the theme for today's video is going to be structural stability. So right now, I'm going to be teaching you how to perform some muscle testing. Now let's get started. And while we are resting, it is time to switch body areas. We've fully assessed the upper limb. Now we are going to move on to the lower extremity. And for these first assessments, we are going to perform them all in supine. Whenever I'm performing muscle testing, I like to perform everything in a nice logical order and have the patient move as minimally as possible. So I'm going to have them be in supine first, then I'm going to do all of my side lying testing and then all of my prone testing. The first one for supine position is going to be the hip flexors. So things like the iliopsoas, your iliacus, your psoas, also your rectus femoris. You're going to have them in a supine position. With the hip, you want them to flex the hip to 90 degrees and flex the knee to 90 degrees. And for this one, you can rest the hip or you can rest the ankle on your shoulder. And then what you would do with the testing arm is you would wrap it around the distal end of the femur. From here, you would tell them, I'm going to pull you down. Do not let me pull you down in 3, 2, 1. Hold. Apply a pressure, match their pressure, add a little bit extra, and then relax. Then we are going to move on to the adductors. With regard to the adductors, we are going to test a couple of different ones. We're going to test the anterior fibers, the middle fibers, and the posterior fibers. If we are testing the anterior fibers, what we would do is just have them in this supine position. And because we're going to be pulling them away from the midline, we don't want them to be unstable. So you're going to ask them to use their hands to grasp the sides of the bench so that they could be nice and stable. From that position, if we want to test the anterior fibers of the adductors, what we would do is have them go into maximum medial rotation of the femur. So their toes, you want them pointing inward. Then from this position right over here, and I'll do it on the opposite side, that way I'm not blocking your view. What you would do from this position over here, so they have their toes pointing inward, you would want to use your stabilizing hand at the greater trochanter of the femur, and then at the distal end of the femur, you are going to move it. So I'm going to move you away from the midline. Do not let me move your leg away in 3, 2, 1. Hold. Apply a pressure, match their pressure, and then add a little bit extra. And we got time to do a couple more. To test the middle fibers, we would do the exact same thing, but the foot is going to be in a neutral position. So we're stabilizing at the greater trochanter of the femur, and then we are using the moving hand at the distal end of the femur. Same thing though, they're grasping on the side of the bench. They're in that position. Their toes are pointing straight up in that neutral position, and I'm going to pull you away. Don't let me pull you away in 3, 2, 1. Hold. Match their pressure, add a little bit extra, see if they're able to maintain it. But rest is up, time for set number 3. And while we are resting, we have one adductor left to test, and that is going to be the posterior fibers of the adductor. Because we are testing the posterior fibers, we want to have the patient in a supine position. They're going to be grasping the table so they can be nice and stable. And then we want them to laterally rotate the femur as much as possible so their toes are going to be pointing out to the sides. From this position, with our stabilizing arm, we are going to be stabilizing at the greater trochanter of the femur. And then with the moving arm, we are going to be placing it at the distal end of the femur. And we are going to instruct the patient. I'm going to pull you away from the midline. Do not let me pull you away in 3, 2, 1. Hold. Match their pressure, add a little bit extra, see if they're able to maintain it. That covers it for the adductors. Next, we are going to move on to the quadriceps. For the quadriceps, the way that we would test this one is they are once again going to be in supine position. For this one, they don't need to hold on to the bench because we are testing it in the sagittal plane, so we're not going to be moving all over the place. And what we would do is with the non-working leg, we want to flex the hip to approximately 45 degrees and the knee to 90 degrees so that the foot is nice and flat on the table. Then, this is going to be a little bit tricky to do on a skeleton, but what I would want to do with the working leg is I'm going to flex the hip and knee to 90 degrees. And then the way that I'm going to stabilize this one is I'm going to place one hand on the distal attachment of the femur, and then I'm going to use that as an anchor point so I can stabilize this leg. So your forearm is going to act as the stabilizer for the working leg. I'm then going to have them place their knee at 90 degrees, and I'm going to instruct them. I'm going to push your foot down. Do not let me push you down in 3, 2, 1. Hold. And see if they are able to maintain the position. That is the general quadriceps muscle testing exercise. We could also test the different muscles. So this would be great for the vastus intermedius if the toes are pointing straight out. We could also have them point their toes in. If their toes are pointing in, we could target the vastus lateralis, but it would be the exact same thing. So toes in, I'm going to push down. Don't let me push you down in 3, 2, 1, hold. Match their pressure, add a little bit extra, see if they can maintain it. And then if we want to test the vastus medialis, we would do toes out. So we would have them go into lateral rotation of the tibia. I'm going to press down. Don't let me press you down in 3, 2, 1, hold. Match their pressure, add a little bit extra. And that is the muscle testing for the quadriceps group. Rest is up. Time for set number 4. And while we are resting, we have 2 left for the supine position. Let's see if you guys can guess what they are before I tell you. Well, you guys should know by now we start proximal and work distal. So we already went to the hip, the knees. Next, we have the ankle. And at the ankle, first thing we're going to do is we are going to test the plantar flexors. Specifically in this position, we are going to be testing the gastrocnemius. Now, with regard to the gastrocnemius assessment, the way that we would do this one is we would have the patient go into maximum plantar flexion. And then with our stabilizing hand at the distal attachment of the tibia and fibula, that's where we would stabilize. And then with the moving arm, we would want to cup the calcaneus, and then we are going to use our forearm as a leverage point to test the muscle. So they're starting out in maximum plantar flexion, and just tell them, I'm going to move your toes toward your head. Don't let me move you. In 3, 2, 1, hold. See if they give up a little bit. Again, you're just matching their pressure and then adding a little bit extra. You're not going to go an insane amount, especially if you're a large therapist and you're performing this assessment on a tiny patient, because that's going to skew the results. Next, we are going to move on to the dorsiflexors. For the dorsiflexors, very similar. The only difference is we are going into maximum dorsiflexion. But in terms of the stabilizing arm, we are at the distal attachment, or at the distal portion of the tibia and fibula. We are going to have the patient go into maximum dorsiflexion. So we have them point their toes toward their head as much as they can. And then from this position, you are going to grasp over the medial arch onto the foot, and you want to try and bring them down to the floor. So just tell them, I'm going to try and bring your foot down to the floor. Don't let me bring you down to the floor. In 3, 2, 1, hold. Give a little bit of a pull, match their resistance, add a little bit extra, and see if they're able to maintain that position. And that covers it for everything in the supine position. Next, we're going to move on to the sideline position. So for the sideline position, I want to figure out how I'm going to do this so that you guys can get the best view possible, and so Johnny does not fall over. But our rest period is almost up. We got about 30 seconds left. If you guys have any questions with regard to any of the assessments that we've done so far, go ahead and let me know. But with all of the sideline positions, the bottom leg, we want the hip and knee flexed to 90 degrees. And this is just going to make it easier for the patient. It's going to allow them to be a little bit more stable. If we just have the legs straight out, then it's going to be very unstable for them and it could skew the results. So make sure that the bottom leg, the hip and knee, is flexed to 90 degrees. But we got a little bit of rest period. On to set number 5. And while we are resting, it is time to move on to the muscle testing in sideline position. We have 3 that we are going to be testing for, and let's see if we can cover them all in this one video before we move on to the next set. With regard to the sideline, again, in a sideline position, the hip and knee is flexed to 90 degrees. That way the patients can be a lot more stable and you don't skew the results. All 3 of these are going to be for the hip abductors. With regard to the abductors, first we are going to assess the anterior fibers of the abductors. So in this sideline position, we want to get them abducted at the hip. So we're going to get them moving away from the sky. And to test the anterior fibers, what we want to do is have them go into lateral rotation. So they're going to point their toes up toward the sky. From this position right over here, we are just going to stabilize at the pelvis. And we are going to have the moving arm. You could either place it at the distal end of the femur or at the distal end of the tibia and fibula. And you are going to apply a downward pressure. So instruct the patient. I'm going to press down. Don't let me press you down. In 3, 2, 1, hold. You match their pressure, add a little bit extra, and then if they're able to hold it, you relax. That was for the anterior fibers. So anterior fibers, toes are pointing up. Next, we are going to assess the middle fibers. For the middle fibers, same set of position, but their feet are in a neutral position. So for this one, we are having them abduct the femur by raising it up off the table. And their toes are pointing straight ahead for this one. But same thing with the stabilizing arm. We could place the stabilizing arm at the ilium. And then with the moving arm at the distal attachment, at the distal fibula and tibia. And we are going to apply a downward pressure, instruct the patient. I'm going to press down. Don't let me press you down. In 3, 2, 1, hold. Match their pressure, add a little bit extra, see if they're able to hold it. The last for the abductors and sideline position is going to be for the posterior fibers. For the posterior fibers, same setup position. The only difference is we are going into medial rotation. So we want them pointing the toes down toward the floor. So we're going to start in abduction. The toes are pointing down. We have the stabilizing hand at the ilium. The moving hand or the testing hand is going to be at the distal portion of the tibia and fibula. And we are going to instruct the patient. I'm going to press your leg down to the floor. Don't let me press you down in 3, 2, 1. Hold. Apply a pressure. Match. Add a little bit extra. See if they can hold it. And that is how we assess the abductors of the hip. And that is everything for sideline. And we finished just in time. Time for the 6th and final set. And while we are resting, let's get into the prone position muscle testing. We're going to start at the hips, and we are going to focus on the gluteus maximus muscle. For the gluteus maximus, we're going to be doing 2 different tests. We're going to be testing the inferior fibers, and we are going to be testing the superior fibers. If you recall, the inferior fibers of the gluteus maximus are responsible for adduction, so bringing the thigh in toward the midline, and the superior fibers are responsible for abduction, moving it away from the midline. So for the first one, for the inferior fibers, what we are going to do is have the patient in a prone position. We are going to flex the knee to 90 degrees, and then we are going to have them lift their leg up off the ground. Once their thigh is up off the ground, all we are going to do is take our stabilizing hand and we are going to position it right at the sacrum. And then with the testing hand, we want it at the distal portion of the femur. For this one right over here, it's going to be a little bit different to do it on Johnny because his foot is just going to collapse forward. Normally, when you were doing this on a real patient, your hand would be over here, but I don't want Johnny's leg falling, so I'm just going to have it resting on my arm. But you're stabilizing on the sacrum, and I'm going to press down in 3, 2, 1, hold. Apply a downward pressure, see if they're able to maintain it, add a little bit more, and then relax. If we want to test the superior fibers of the gluteus maximus muscle, because they are responsible for abduction, we would do the same thing. We would have them flex the knee to 90 degrees. The only difference for this one is because it's responsible for abduction, we would abduct the femur to 45 degrees, but the testing is the exact same thing. So we are going to go ahead, stabilize at the sacrum, and I'm going to apply a downward pressure with the moving hand at the distal femur. In 3, 2, 1, hold. Match the pressure, add a little bit extra, see if they're able to maintain it. And that was for the gluteus maximus muscle. Do we have time? Yeah, we should have time for one more. Next, we are going to do the hamstrings. For the hamstrings, we are going to have them go into knee flexion. And then for this one, what we would do is just place one stabilizing hand at the distal femur. The other hand, we would wrap it around the inside or the medial aspect of the tibia and fibula at the distal end. And then we are going to do 3 different positions. When the toes are pointing in, we're primarily going to be assessing the semimembranosus and semitendinosus. In the middle, you kind of get an even distribution of each. With the toes pointing out, it's primarily going to be the biceps femoris and semitendinosus. But the testing protocol is the same for all 3. Stabilizing hand, moving hand. I'm going to pull you. Don't let me straighten out your leg in 3, 2, 1, and hold. Add a little bit extra, and then relax. So feet neutral was for the semitendinosus, biceps femoris, and it's pretty much all 3 of them. It's going to test them equally, but rest is up. Time for set number 2. And while we are resting, I'm just going to go ahead and show you the other 2 hamstring variations because we do have a little bit of extra time, and these are the last few assessments for the prone position. So I'm not going to have time to set up the other one, but in prone position, we have them flex the knee to 90 degrees. And then what we would do if we want to test the semimembranosus and semitendinosus is we would have them point the toes inward from that position over the medial aspect of the distal ends of the tibia and fibula. We're going to wrap our arm around. We are going to stabilize at the distal femur and instruct the patient. I'm going to straighten out your leg. Don't let me straighten your leg in 3, 2, 1, hold. Give a little bit of a pull, see if they're able to maintain it. And then if we want to test the biceps femoris and semitendinosus, we are going to point the toes outward. So they are going into lateral rotation of the tibia and fibula. Same thing, we are stabilizing at the distal end of the femur, and we are moving at the distal end of the tibia and fibula. You're going to instruct the patient however you want. I am going to bring your foot toward the table. Don't let me bring your foot toward the table in 3, 2, 1, hold. Give a little bit of a pull, match their pressure, add a little bit more, see if they're able to maintain it. And we have one left for the prone position, and that is going to be for the soleus. We already did some of the plantar flexors in supine position. However, that was with a straight knee. If you recall, the gastrocnemius is a plantar flexor, but it's also a knee flexor. So when the knee is straight, that is when the gastrocnemius is going to be most engaged when we're doing plantar flexion. However, the soleus only crosses the ankle. So because the soleus only crosses the ankle, it is solely responsible for plantar flexion. And the way that we would do this is to eliminate involvement of the gastrocnemius. We are going to flex the knee to 90 degrees. That way we could put some slack on the gastrocnemius. But we're going to do the exact same thing for this one as we did with the gastrocnemius muscle testing. We're going to have them go into maximum plantar flexion by pointing their toes toward the sky. And then the way that we are going to stabilize this one is we are going to stabilize at the distal tibia and fibula. And then we want to grip over the calcaneus with our palm. And we're going to use the palm as a fulcrum, and our forearm is going to be trying to push it down. You're going to do the exact same thing, though. I'm going to press your foot down toward the table. Don't let me point your toes down toward the floor. In 3, 2, 1, hold. You're going to push that elbow down toward the floor. See if there's any give. Add a little bit more pressure once you've matched theirs. See if they're able to hold it. And that concludes the testing in prone position. Time is up. When you get back, we're going to get into the trunk, but set number 3. Thanks for sticking around until the end of the video. Be sure to like, share, and leave a comment as it'll help the algorithm. And if you enjoyed the content, show your support by subscribing to the channel by clicking on the icon in the bottom right corner. And if you really want to show your support, then consider becoming a member by clicking on the icon in the bottom left corner. These new high-quality videos aren't cheap to edit, and the $5 membership will really help with the video editing budget. You'll also get access to a ton of exclusive perks like early access to videos and this program design lecture playlist in the top right-hand corner. And if you want to learn how to do a one-armed pull-up, then check out the playlist on the top left corner.